Hello everyone, Gabby here from bootcamp.com, and for today's video I'll be talking about the dural venous sinuses. So the dural venous sinuses are really what represent the venous drainage of the head. So all the blood or the deoxygenated blood that is traveling within the brain or within the head that needs to be brought back to the heart travels through these venous sinuses. Now, these venous sinuses are formed based on the separation of the two layers of the dura mater. So when these two layers separate, they form this space in which these dural venous sinuses can take place. So if we have a look here, so here would be the periosteal layer of the dura mater, and here we can see the meningeal layer of the dura mater. And you can see in between these spaces where we're going to have these venous sinuses. So the first one that is running more superiorly in a sagittal plane along the areas of the brain and the skull is going to be the superior sagittal sinus. So we can see that one over here as it travels along these areas there. Now, the venous sinuses are not only important for venous drainage or blood drainage of the head, but we also can get the CSF drainage. So we know that the brain contains the choroid plexus. The choroid plexuses are responsible for producing the cerebrospinal fluid, so the CSF. And we know that the CSF is super important for bathing the brain and bathing the spinal cord and providing the buoyancy and protecting the brain itself as we're essentially moving our heads. It limits the movement of the brain in the cranial cavity, and it also allows for the removal of waste products, and it also allows to maintain a stable chemical environment around the areas of the central nervous system. So we have the choroid plexus that is producing the CSF, and the CSF is traveling within the subarachnoid space. So then the subarachnoid space of the brain and the subarachnoid space of the spinal cord. Now, as we know, these choroid plexuses are constantly producing CSF. So the CSF that is traveling within the subarachnoid space needs to eventually be drained. And through these arachnoid granulations, so the extensions of the subarachnoid space into the sinuses is what allows the drainage of the CSF to occur. So essentially within these sinuses, we have a mixing of CSF and venous blood. So we can see here that the arachnoid granulations are going to go ahead and drain directly into the superior sagittal sinus. Now, the superior sagittal sinus is going to travel and is going to connect with other sinuses posteriorly at this area, what we call is the confluence of sinuses. So I'm going to go to our next image here, and I just want to orient you before we continue. So this is a superior view of the skull. So I want you to imagine we've taken a cut, and we've actually removed the half portion of the skull, and we're looking on the internal aspect of the skull. We've also, of course, removed the brain, so we can only really see the bone as well as those sinuses. So I mentioned before we had the superior sagittal sinus that is running in that, superior and sagittal direction. That's going to travel posteriorly here, where it will form or contribute to the confluence of sinuses. We can see here that the confluence of sinuses will go ahead and form two transverse sinuses, one on the left, and we also have the right transverse sinus on the right. So these sinuses are running in a transverse direction compared to the superior sagittal sinus that is running in a sagittal direction. The transverse sinuses will eventually go ahead and form the left and right sigmoid sinus. And they get this name sigmoid because they form this S shape. So we can see that on the left. We can also see the S shape being formed on the right. Now, another important sinus that we have that you may have heard before is the cavernous sinus. And the cavernous sinus is going to be found on the right, and we also have one on the left as well. And we can see that the cavernous sinus sits immediately lateral to the sella turcica. And the sella turcica is going to be the area where we house the pituitary gland. And one important thing to note about the cavernous sinus are the contents that will actually pass through this sinus. So we know that the brain should be within this image, and we know on the inferior aspect of the brain, we do have a lot of cranial nerves that are leaving the brain and eventually exiting the skull to get to their target areas. So as these cranial nerves come off the brain, they pass through the cavernous sinus before they exit through their respective foramina. So in this case, in the cavernous sinus, so here in blue is the cavernous sinus. This is a frontal or coronal section. We can see here that we have a few cranial nerves that pass through, including the oculomotor nerve, the trochlear nerve, the ophthalmic nerve, the abducens nerve, as well as the maxillary nerve. So any conditions or infections that spread through the cavernous sinus could potentially impact these nerves and their functions. We can also see another really important structure that passes through the cavernous sinus after it has entered into the skull. We have the internal carotid artery. So all of these structures can be impacted if we have some type of infection or even thrombosis of the cavernous sinus. So we can see here, projecting posteriorly from the cavernous sinus, we can see the superior and inferior petrosal sinuses. Now the superior petrosal sinus will go ahead and join the sigmoid sinus, versus the inferior petrosal sinus will go ahead and drain directly into the internal jugular vein. So the internal jugular vein is a major vein or a big vessel that essentially is responsible for the venous drainage of the whole head. So all the blood and the CSF that is within these sinuses will eventually reach the internal jugular vein, and then that internal jugular vein can exit the skull at the level of the jugular foramen and eventually travel or descend downwards, where it can then join within the carotid sheath among the common carotid artery and the vagus nerve. And then all that blood can eventually be brought back to the heart. So let's look at these sinuses again. So here's our sagittal view. So here we can see the superior sagittal sinus. Now another sinus that I haven't mentioned yet that runs in the same direction as the superior sagittal sinus is going to be the inferior sagittal sinus. So it's the same as the superior, but it's just more inferior. And both of these sinuses, so the superior and the inferior sagittal sinus, are going to be running within the falx cerebri. So the falx cerebri are essentially the dural folds or the extensions of the dura mater that will eventually separate the left and the right hemispheres. So that inferior sagittal sinus will also travel posteriorly, where it will form the straight sinus. And it's the straight sinus that also contributes to the confluence of sinuses similar to that superior sagittal sinus. We can then see here the confluence of sinus forming the transverse sinus that eventually forms the sigmoid sinus that could eventually drain into the internal jugular vein. Alright, so let's see what you've learned today. So fill in this flowchart showing the pathway of venous and CSF drainage. So pause the video, come on back when you're ready. So if we start off with our inferior sagittal sinus here, the inferior sagittal sinus will travel posteriorly, where it will form the straight sinus that will then go and contribute to the confluence of sinuses. So remember, the confluence of sinuses is where we have the connection of a lot of the different sinuses, including that connection with the superior sagittal sinus. The confluence of sinuses will then extend transversely, right? Those travel a little bit more laterally and form the right and left transverse sinuses. We then said that the transverse sinus will form the sigmoid sinus, so that S-shaped, that will then drain into the internal jugular vein. We also mentioned the cavernous sinus, a super important structure adjacent to the sella turcica and the pituitary gland that will eventually form the superior petrosal sinus that will drain into the transverse sinus, versus the inferior petrosal sinus will directly drain into the internal jugular vein. And then all of that venous blood and all that CSF that's in the blood can eventually be brought back to the heart. Next, label the dural venous sinuses and then come on back when you're ready. So for this question here, we've already looked at this image. So we have the superior sagittal sinus superiorly forming the confluence of sinuses posteriorly. We then have extending off again those confluence of sinuses. We have the transverse sinuses forming the sigmoid sinuses, right? The S shape that we're seeing here. And then we could also see the cavernous sinus on either side of the sella turcica that will eventually give off the superior petrosal sinus, as well as the inferior petrosal sinus that can either drain into the sigmoid sinus if you're the superior petrosal sinus, or drain directly into the internal jugular vein if it is the inferior petrosal sinus. Here are the references for all the images I used today, and I hope you enjoyed this lesson on the dural venous sinuses. Please let us know if you have any questions.